Pauline Isabel Centeno from BSN 2A, and today I will performing the bag technique. So the bag technique or the public health nurse bag is a tool that used by the nurse during home and community visit, will able to provide care safely and efficiently. And then, so the public health bag is essential and indispensable equipment so of a public health nurse, which has to carry along during the home visit. So it contains visit medication and articles which are necessary in giving care. And then the bag contains all necessary articles, so supplies and equipment which may be used to answer emergency needs. And then it is also to render effective nursing care to the clients or other members of the family. And then or during to our home visit. So the content of our bag, to be more specific, is the soap and a covered soap dish, linen or disposable paper towel for hand washing, paper lining, apron, 70% alcohol, which is for infection control. So for articles, for assessment of family members, we have thermometer, both oral and rectal, measuring tape, weighing scale, Benedict test, medicine dropper, medicine cup, medicine tray, test tube holder, alcohol lamp. And then we need articles for nursing care. We have sterile equipment or items. So 2 pairs of scissors, 1 surgical and 1 bandage, 2 pairs of forceps, 1 curve and 1 straight, syringes 5 ml and 2 ml, hypodermic needles, so sterile dressing, sterile plastic cord clamp, and sterile gloves. So we also need clean gloves, betadine, ophthalmic ointment, hydrogen peroxide, spirit of ammonia, acetic acid, Benedict solution. So we also have pieces of paper, so for lining the soap dish, and folded paper or retractable paper. So we need to assessment. So we need to first observe the surroundings or the areas where we perform the bag technique with ease and effectiveness. So upon absorbing the area of so we must prepare ourselves before we interact to our target patient in our community. So in performing home visit, it is essential to prepare a plan or before the visit to meet the needs of the client and achieve best result of desired outcome. So we will now use all available information to the patient and his family through the family records before we perform home visit. So for planning, we need to introduce ourselves and verify a client's identity and explain the procedure. So we will now explain with the family the purpose of our visit and explain what we are going to do and the reason for doing the procedure. So hi, good day. My name is Nurse Pauline from Bulacan State University. So today I will perform a home visit for your family. So to assess your home and family situation, in order to provide necessary nursing care and health-related activities. So, are you the Santos family? Okay, ma'am. So, in explaining the procedure, we will explain that, so mom, the purpose of my home visit is to assess the living conditions of your family and your health practices in order to provide appropriate health teaching. It is also give health teaching regarding to the prevention and control of diseases. And also, ma'am, today I will perform temperature measurement, which is very essential because it characterizes many diseases because it associated with the change of our body temperature. So, no? So we also here to provide basic health services for minor ailments such as injury and abrasion. So we also here to provide counseling on family planning, immunization, nutrition, and to give health teaching regarding the prevention and control of the diseases. So after entering the client's house, so we'll enter. So we will now take our paper lining on the back pocket of our bag. So we will place our paper. So after taking it, we will now lay on the flat surface of the table and on the chest or the box. So if none, we can use the floor. So we must remember that the clean side must be out and the folded part is touching the table. So we must also consider that everything inside the bag is sterile. So that's why we need to use the inner part of the paper because it's sterile. So because the folded part is more exposed to contamination. So we will now place our bag on the left side of the paper lining. So here, with the bag opening, so facing on the working area. So we will place our bag. It must not lay on the floor or the table. So we don't want to contaminate our bag. So we must place it on the paper lining. So it is open on our working area so we can easily get the things we needed. So for implementation, we will now open the bag and take out the plastic lining. So place the plastic lining over the paper lining. So we will now ask for the basin with water. So 2 basin. So here. So we will place our plastic lining to have double protection from contamination. So in asking the basin for the water, we can say, "Mom, can you give me as small basin with water so that I can wash my hands with soap. Thank you po. And then, we will now open our bag. And we will now bring out the soap with towel. So here. So we can now prepare for hand washing. So we will now close our bag without locking and perform hand washing and dry with towel. So hand washing is very important because hands are primary carriers of dirt, germs, and viruses and bacteria. So without proper hand washing, this can lead to harmful or spreading of diseases and causing cross-contamination. So in performing hand washing, so we must follow proper procedure. We must wet our hand first. We will get our soap and create a good batter. So we will rub our palms together. So palm to palm in circular motion. Rub the back of the hands and the other hand. A finger link on the other hand. So interlink the fingers facing each other. And so the other hand. So clean our tongue, regular motion in the fingers. There it is. So if a clean nail brush, we can brush our nails. So we will now rinse our hands under a clean water. So here. So dry them thoroughly using our hand towel. So after hand washing, so we will now put the soap in the soap dish. So over it, we will now place it outside the plastic lining. So we will now place it on the paper lining here. So in the hand towel on top of the soap dish. So here. And then we will now put our apron while observing proper technique. So we will now get the apron in the bag. And we will now get it out. Remove it to the plastic. So return it the plastic on the bag. And then, so apron will protect us from infection risk because we can have contact in the patient or other materials that may lead to contamination of our uniform. So we don't want that. So, and also to avoid risk of contamination with blood and body fluids. So since we don't have any disposable apron, so I will just use kitchen apron. So we will now remove the apron from the roll. So here. So unfold it. So open it outward. So the inner surface must faces the patient. and then we will shoot the loop on the neck. So since it has on the shoulder, so I shoot it on the shoulder, and then we will now fix the apron properly, and we will now tying it on our back. So after tying it, so we will now bring out the articles needed for care. So make sure that they are placed in the plastic lining, so here in the orange part. So we will now take out the medicinal tray, thermometer, our dry cotton balls, our cotton balls with 70% alcohol. And then we will now place our paper receptacle outside our working area. So we will now place it here. And then we will now put our used cotton balls and discard other materials in paper receptacle. And then this is to prevent contamination. So after that, we will now close the bag and perform nursing care. So mom, you will now get your temperature. So we will just open the case, open our thermometer, and then place it in our client. So we will just wait until the temperature of the client is finished. So after we hear the beep, so we will get the temperature. So I get 35.5 on the client. So it doesn't indicate a fever, so the temperature range is normal. So after that, we will turn it off and we will now perform aftercare of materials. So open our 70% alcohol. So we will now use cotton balls with alcohol. So from the tip, discard it. Other side. So place it back to our case and then use cotton balls. So we will get it back so that it will not be contaminated. In this single tray. So we just return it immediately in the bag so that we can avoid contamination. we will just pick one cotton balls. So another one again. So I turn it. So clean the plastic lining. This is to avoid spreading and contamination. So we will now discard our paper receptacle on the trash bin. So we will now wash our hands with proper technique and dry hand with a towel. So first, we will now begin as a new set of water. So wet our hands. So get our soap. Get a good lather in the back. Dirty the fingers. So rinse. And we will now dry our hands. So after hand washing, we will now open the bag and we will now return all the article used. The plastic lining, the bulb, put the soap dish and the towel lastly. So the hand towel is on top of our soap dish. So this is to, after that we will now take out or remove our apron. So while observing proper technique, you must not touch the outer area. Hold it. So get the plastic. And put it back. Right now we will now place it at the back of the bag. Okay. Because it's now contaminated and we don't want other materials to be contaminated. If we use disposable apron, we must dispose it with hazardous waste bin properly. So after that, we will now lock our bag. So after locking it, we will now get our bag. So here, and we will now fold the paper lining without touching the contaminated area or the outer side, and discard it. So for evaluation, the bag and its contents are well protected. So from contact with any article in the home of the patient. So, and the bag and its contents are free from infection. So, as we evaluate, so we don't see that our bag is infected. So we must make sure that our bag is sterile and all the equipments are still sterile to avoid contamination. And we must disinfect it before keeping and using it. So we must also record relevant findings about the client and the members of the family. And then we will now take note for environmental factors which affect the family health status. So including quality of care, we must assess the patient response. Lastly, we must also assess the effectiveness of our nursing care provided. So thank you po.